Let's talk about why service dogs improve sleep and reduce nightmares. The science of physical contact and sleep. Sleep issues and anxiety affect a lot of people and are common issues that people who suffer from medical and psychiatric diseases deal with on a regular basis. One example is post-traumatic stress disorder. PTSD, as it's also called, is one of the top 5 reasons people get a service dog. For many patients with PTSD, the solution to sleep issues and other problems related to their PTSD diagnosis is a canine friend. One challenge that patients who have PTSD deal with is elevated heart rates and a higher risk of cardiovascular disease or heart disease, possibly because their autonomic nervous system is in overdrive, and this is associated with anxiety issues and avoidance of social interactions. These patients have higher heart rates than normal both during exercise and at rest, and ultimately, like I mentioned, they have higher rates of heart disease. Fortunately, PTSD service dogs have been shown to help decrease patients' heart rates closer to normal levels. This effect can potentially decrease issues with anxiety and insomnia, as well as risk of heart disease. As a reminder, insomnia just means difficulty sleeping. 45 vets with PTSD were included in one study, and all of these vets were undergoing residential psychiatric treatment. So they had really similar schedules in terms of their activity, when they took a meal, when they went to bed and got up in the morning, because it was all regimented and based on their inpatient psychiatric service. And they looked at their heart rates overnight. They did overnight heart rate testing, and they actually compared the patients when they did and did not have a service dog on each night. And so the patients kind of acted as their own controls in that way. They compared their nights when they did have a service dog to the nights when they did not. And what they found was that when the patients with PTSD had a service dog, they actually had reduced sleeping heart rates that were closer to what a normal individual who does not have PTSD, what their heart rate would be like. And that effect was actually more pronounced for patients with more severe PTSD. Not only does PTSD affect people's heart rates, but it's associated with sleep disturbance at night as well. Patients with PTSD often suffer from nightmares that interrupt their sleep and affect their quality of life. Good sleep is critical for everyone, and if you have ever experienced difficulty with sleeping, like insomnia, you understand how vital good sleep is to have a good quality of life. Service dogs are a helpful intervention to improve patients' sleep. So let's talk about another example of data coming from the PTSD population. This study included 65 patients, and they broke those patients up into 4 groups. One group was 20 patients who had PTSD and were given a service dog. Another group was patients with PTSD who just had a companion dog. And then there was another group of just patients with PTSD and there was no dog. And then there was a 4th group that was just a bunch of patients who did not have a diagnosis of PTSD. And again, there was no dog. And they made comparisons in this study between those groups. And what they found was that veterans and first aid responders with PTSD who had a service dog showed significantly less PTSD-related symptoms. They showed better sleep quality, and they reported better well-being when they compared that group to the group of patients who also had PTSD but only had a companion dog. So again, this was a comparison between the service dog group and the companion dog group. They also reported that those with a service dog experienced fewer PTSD-related symptoms than those without a service dog, and tended to walk more than individuals who didn't have PTSD. Now you might be wondering, so it sounds like PTSD service dogs and perhaps service dogs in general help patients who have anxiety issues like those who have PTSD suffer from. and nightmares. Their sleep gets better when there's a service dog intervention. But the question is, does it affect the sleep of the partner? So one study actually looked at that, and they looked at the sleep patterns of the 88 veterans' partners. This was a survey study, and they also used objective measures of sleep. So quality or ratings of sleep as well as objective measurements. And what they found was service dogs did not interfere with their partner's sleep. The service dogs were not found to be disruptive at all to their sleep. They also found that the partner's sleep didn't improve with the service dog being present. I think that makes sense because the service dogs really get trained to work with their handler, with their patient, the person they're trained to help with. So the focus is probably not on the partner. All right, so we talked about why we care about good sleep and how it affects people with psychiatric problems. A very common studied population, in part because it affects a lot of veterans, is patients with PTSD. But patients with PTSD are similar to other patients who have psychiatric diseases that have a lot of anxiety and sleep disturbance involved, like generalized anxiety, for example. We also discussed the improvements patients have from working with service dogs. So how do service dogs help with sleep? What do they actually do? Well, when we train service dogs to assist people with all sorts of mental health challenges, we train them to do a few things. One is they make contact physically with their handler to help calm them down, and they're constantly next to their handler. Another way is they will create space for their handler. For example, if they're in a crowd of people, the dog will help create room around the handler so they don't feel like the crowd's closing in on them quite as much. And they'll also do something called applying deep pressure therapy. Deep pressure therapy is using their body to make contact with the patient, but in this case, they're often maybe sitting in the patient's lap or laying on top of them. These therapies apply to a number of different diseases, like I mentioned, including autism, anxiety, panic disorder, and as we've talked about, post-traumatic stress disorder. Creating space works by allowing someone who is suffering from anxiety to feel like they have room in the crowd. And then deep pressure therapy, like I mentioned, is where the dog will apply their body weight to their handler to calm their body down. When the dog makes physical contact with the handler, this essentially grounds the patient and brings their focus into the present and provides them with a sense of comfort. This can significantly improve a patient's state of mind when they experience anxiety or when they're having sleep disturbance and insomnia. So how common and effective is this kind of intervention for patients? Well, there was a survey study of 199 psychiatric service dog owners, and they asked respondents to report what behaviors their psychiatric service dog performed for them, the handler. And this was the handlers responding to survey data. Now, what they found was that 94% of the handlers said that they had reduction of anxiety through tactile stimulation. 71% said nudging or pawing was performed by the dog to bring them back to the present. 51% said the dog interrupted undesirable behavior. 50% said the dog maintained constant body contact. 45% cited deep pressure stimulation, and then 42% mentioned blocking contact from other people. So as you can see, tactile stimulation, constant body contact, deep pressure stimulation, and blocking contact with other people. The majority of what they reported the service dog did were some of those very things we just talked about. Now, deep pressure therapy has been shown to benefit patients with mental health related issues, specifically surrounding issues of anxiety. There have been some studies that looked at deep pressure therapy, but in this case, it's administered by a weighted blanket. And there's a meta-analysis that looked at the effects of weighted blankets on 553 psychiatric patients, both in the inpatient and outpatient setting. So people who are hospitalized and also people who are not hospitalized but just being seen in a clinic. And the diagnoses of these patients were a number of things, including depression, bipolar disorder, ADHD, and autism. Of the 553 patients, 289, roughly half of them, received a weighted blanket, and comparisons were made between those groups. What the authors reported were that 4 of the studies reported evidence for weighted blankets in improving insomnia, total sleep time, and sleep onset latency. So in other words, they slept for a longer amount of time, and they were also able to sleep earlier rather than staying up late being unable to sleep. 6 studies reported evidence for reducing anxiety symptoms. All right, well, I'm Dr. Raj. I'm a medical doctor and co-owner of Summerfield Service Dogs. I hope you enjoyed our discussion today. If you're interested in a service dog for yourself, please give me a call or send me an email, and I'd be happy to help.